thanks for dropping by. My name is Paul Pakeman. I'm the founder of Citizen Psychiatry and also developer of the Recovery Protocol Breakthrough. I want to point out a few things about what you'll be seeing in this intro video. One is the introduction to the flash drive forms. It's proprietary to the Recovery Protocol Breakthrough in Citizen Psychiatry. And with this flash drive form, all the recovery data or information about the person's life that's pertinent to making a recovery is gathered. It's gathered in one sitting. It takes about 10-15 minutes. But what the benefit of this is that, as some of you know, is that it can take many months to collect this information. From the interview time that you have with your physician or psychotherapist, for example, it can take months. And so this is right on hand. You just hand it in to the person. The other segment that we'll be looking at is a stage interview. I'd like to have you get a sense about what this interview style is like, and you'll be able to see it. Fortunately, I was able to get Kay, that's her first initials, and she's agreed to be here to do a stage interview with us. The content is real, though. It's something that she's been through. And then the other thing that we'll be looking at is what is a recovery, and we'll talk about that after the interview with Kay. One of the things that I'd like to do at this point is introduce you to this facet of the program, the flash drive forms. It's our proprietary signature of the Recovery Protocol Breakthrough. To support the inclusion of the Recovery Protocol Breakthrough in the meeting room space, salient recovery data is required for the person and their provider. As a result, Citizen Psychiatry has developed our proprietary flash drive forms for consumers available on this platform to port critical recovery data completed in the comfort of their homes into the meeting room. All it takes is less than 15 minutes. In a single sitting, the provider can see the chief components identified that impede recovery and personal resources that build recovery, rather than taking months to accumulate the same information. The flash drive forms information also provides a map of a person's recovery landscape. The program utilizes this information on the flash drive forms to kickstart recovery and see it through. Also, the program outlines the methodology and provides a step-to-step guide for providers and consumers. A section on the flash drive forms is also devoted to physician providers and the patients served. So that's the proprietary flash drive form. The Recovery Protocol Breakthrough surrounds this form, the data in this form, and this is what allows the program to exist through these interviews with you. And welcome to this stage interview. I would want to be able to give you a sense about what the interview is like in the Recovery Protocol Breakthrough. Kay is here. I'm just using Kay for her name as part of the agreement for her to be here with us. Let me tell you a little bit about Kay first. Kay is a mother of two. She had a very vicious physical assault that left her head damaged and a lot of stitches. However, one of the fallouts from that is trauma-induced depression. Kay did and was on medication, but did not find that medication useful for her. It failed her, and the toxicity of the medication left her with extreme weight gain. The other thing I'd like to point out is Kay went to psychotherapy and found that more useful than medications. There are three things I'd like you to observe as we're going through this brief interview process. One is that you'll notice that I will refer to not the depression, but refer to a pet name. Kay has chosen Lost as her pet name for depression. There's a reason for this. One is that we want to take away the stigmatizing and attaching element to the official diagnosis of depression. So we're going to use the pet name. The second thing is that you'll notice at the end of the interview, I'm going to ask Kay to jot down some notes in her journal. The journal is used throughout the program, but I wanted to demonstrate to you what the interview process is about. And the other thing, this interview process is for the provider as well, or the service person who's going to be doing the interviewing. So you'll get a sense of what this style is like back and forth. So without further ado, let's do this, okay? It's okay. Thanks for being here. I'd like to point out, just for the viewership, because this is a stage interview, but I'd like to point out that the content that you'll be sharing is a true story on your life.
Yes.
The other thing is, for those is that Kay, prior to sitting here, went through a form that I showed you previously called the flash drive form. The part that we're going to be interviewing is in regards to what feeds your recovery. These recovery care factors, and Kay has chosen one activity that she does that really benefits her, and that's pets. So she's chosen her pets. The reason why this is important, as I talked briefly about previously in the flash drive forms, is the activities that you choose that matters and feeds your life is the gateway that this interview uses to affirm your strengths, to affirm who you are, to affirm what you bring, to affirm what is right in your life, that typically for folks living with medication failure start to feel bad about. They don't feel good about themselves. They beat themselves up in their head. They think they're weak. They think maybe they're broken, too complex to treat, and so forth. And medication failure can affect the psychology of recovery in this way. The aim of this program is to reverse that, so your recovery psychology is strong and that you can get on with your life, regardless of whether or not the mental health issue and the condition exists with you or not. And that's the purpose. So here we go. So Kay, you've chosen pets.
Yes.
So tell me what attracts you to pets, and what kind of pet?
Mainly dogs. I am a dog lover, and I just love that their love is unconditional. I can wake up looking a mess or being a mess at that time. When I got heavily involved with dogs, she never judged me. She was there for me no matter what.
Okay. And how long have you, your bigger dog, how long have you had your dog?
I adopted her about 9 months after my attack.
Okay. How were you introduced to, or the idea of having a dog? When did this happen, and how?
I'd had dogs in the past, but the dog that we had at the time was my children's dog. When I adopted my dog Petal through an organization, she was for me. I adopted her solely for me. She was going to be my dog.
Okay. Okay. So let me ask you about, what's your dog's name?
Petal.
Petal. So let me ask you about Petal. Can you tell me what Petal has supported in your life? Is it as a coping strategy? Is it a fuel that enriches your life? Is it as supplying meaning and purpose, or as evoking hopefulness?
She's somewhat of a coping strategy, but I think more the hopefulness. She was also a dog that had been through trying times. She's a rescue dog from the Dominican. And so she had seen some trials and tribulations in her life too. And me being able to help her made me see more of a light in my life as well.
So what I'll do is ask more about that hopefulness that she gave you, or held for you. So what keeps Petal in your life as a way to develop hopefulness, as to generate hopefulness for you?
She's just unconditional love. I can come home after a really bad day at work, or when you get dismayed by the world and all the traumas going on in the world, I can come home and cuddle her, and it just eases my soul.
Mm-hmm. What do you feel is it about your pet Petal that allows for this?
She's never judged me, and when I adopted her, she also opened me up to a wonderful group of people that were involved in the rescue and that. So she's brought not just her into my life, but she's brought some pretty incredible people into my life as well.
Oh, cool. So can you share a story from your life to help me more fully appreciate the value of pets or Petal in your life?
I do a lot of volunteering now with the organization that I adopted her from, and it allows me, I'm a very nurturing person by nature, and it allows me to give back and just be able to help other people the way she's helped me to put hope into the world.
Okay. Or hope into your life.
Into my life. She's
Your life.
yeah, by bringing hope to other people, it puts hope into my life.
In sharing this, take a moment and speculate on what your life would have been like without Petal at this point.
Well, as my pet name says, I was lost. I was very lost. And she's given me a focus, and she's given me a real purpose to push forward and to be there.
And push forward and be there. So, what does this tell you about the value of engaging with Petal as a pet?
She's just given me a really positive focus, and none of the judgment and none of the stress. Just constantly, because of her love, it brings a lot of light to my life and a very positive nature.
Okay. So, by saying this, would you say that Petal is feeding your life for the better, or is it stifling your life?
Definitely feeding it for the better.
Why would you say that?
She just brings so much joy to me. She's just a pure joy.
Joy.
Yeah.
What does that joy allow?
It allows my heart to heal. It allows me to, have faith in what the world offers, that there's a lot of positive in the world, not just negative.
So by saying this, what are you in effect coming to see regarding the influence you possess for bettering your life?
That I have a lot of control over my life. I can put the things in my life that I need, put the things into my life for the focus that I need, and to be able to nurture and still have that loving feeling after going through such a horrendous experience.
Yeah. What do you make of this influence then that Petal has?
It's a very positive influence. You can have a lot of bitterness when you've gone through trauma, and she just brings that joy into my life.
Is this more or less what you want for yourself, or not so much?
Definitely. I don't ever want to be bitter.
It's easy to say that.
When you go through the sadness and the trauma, you can lose a lot of faith in the world, a lot of faith in the humanity, and to bring the light of her and the people that she's brought into my life, it just restores my faith, and it keeps me going on a positive level.
Okay. So, in your mind, what would you say is the purpose of feeding your life this way with Petal?
I needed positive focus, and I needed to be around people and dogs that bring that joy, and so that you can walk away from that sadness. And she forces me to get out and walk, even in the evening when it might be a little more stressful, but she forces me to be present. She needs me to be present.
Yeah, she needs you to be present. And what does being present offer you?
It pushes me forward to other things too, that I can move forward, that I'm not, you have to get past the fear and be able to just move forward from there.
What does having that perspective do for that loss?
Pushes it back a bit, because having to be present, I can't just wallow in my sadness and not go out and lock myself away. I have to be there.
Okay. As such, what does you were referring to the purpose that feeding your life this way. So what does feeding your purpose in this way tell you about what you're doing for your life?
That I'm moving forward, that I'm putting that in my past, and it will always be a part of me, but I'm not allowing it to take over my life, that I am moving forward with the things that bring joy to me.
So what is it like for you to declare this?
Empowering.
Empowering in what way?
I feel like I've got control now, that I'm not being controlled by an incident that happened in my life that was fairly horrendous, but I'm still able to move forward, that it's not controlling me.
Mm-hmm. So as you reflect on this, what does this commitment say to you about its importance and place in your life regarding Petal?
She's brought the joy back. She's helped me step out where I'm not necessarily always comfortable, but having to be present for her, I'm able to do that, and it gets better and better as I go.
So comment on this for me. What does pedal in any way show you about your capacity to carry and hold yourself through stormy times, especially with loss?
That I can be present and that I can step beyond lost and not allow loss to control me. I can control my life, not the depression.
So based on this, what would you say is it about you as a person that can account for you keeping committed to pedal through tough times?
She's an innocent soul. She needs me there. And no matter what, I have to be there for her. So I can't just let myself fall into lost. And
Yeah. What does that say about you?
it shows that I have strength. I have control. I have strength.
Mm-hmm. And how does knowing this sit with you?
It makes me feel good. Makes me feel like I've come through the storm.
And how does this leave you feeling?
Confident, happy.
So, as I mentioned, that this is a stage interview. We're at near the end of it, and this is a pause protocol. If you could jot down anything that came to your mind as you were sharing what you were, any insights, thoughts, any awarenesses, anything that was affirmed, anything you want to keep and remember. Just have a minute for that. Just jot anything down. Okay. So, can you just share briefly what you wrote down?
I put unconditional love, being present, and stepping outside my comfort level.
Yeah. Okay. I want to point out too, because of this video, is that what happens in the program is with these thoughts jotted down, they get interviewed more. But the major aspect of it is that Kay would take this home and she would expand upon these points for her in terms of what it means and so forth. And then it gets rolled into another interview, just so that you're aware of that. It's there to reinforce the notion of her strengths and who she is and what she brings. So in this reflections, to end this interview process, I have the three things to ask you. I know that was just 10, 15 minutes, but I just wanted to get your impressions. Though this interview is only a taste of around 10 minutes, what for you is the intuitive difference overall between this style of interview and your experience with psychotherapy that you mentioned that you were in?
I think with the psychotherapy, you're more focusing on the negative feelings that you're feeling and the actual depression itself, where with this, you're focusing on positives in your life that will help you realize more about yourself and that there are a lot of positives, and it gives you a purpose to move forward.
The second thing would be, what would you speculate would be the difference if this style of interview was also included in psychotherapy that you experienced? What difference do you think?
I think it would have sped up my healing process, if you will. It would have made me realize how important those positives are in my life. You know they're there, but you don't realize how life-changing those positives can be.
And my last reflection is, what do you feel is the value of this interview style intuitively for someone who has lived with major depression based on this quick introduction?
I think when you go through the depression, again, you tend to look at the negatives more than the positives. And this style really makes you focus on things that are special to you, things that do help you move forward, things that are already possibly in your life that you didn't realize how important they were and how positive they are.
My last follow-up to that is about what then, from what you shared, does it affirm for you or that you have further discovered, even though it's been a short
that there are a lot of things in my life that are positive, even though the lost is just one piece. There's so many more positive pieces that can get me through that. And I think that's important, to look at the positives in your life.
Okay. Well, great. Well, thank you very much for your time.
Thank you.
On to another section with regard to this video that I'd like to illuminate for you a bit is, what is a recovery all about? as you saw in the interview with Kay, lost her pet name for her depression, the trauma-induced depression because of physical assault, left her in a weakened position. The medications weren't working. She gained a lot of weight. And this we call an unrecovered position. And you'll see that in the diagram on your left. This is where the center of her life is the trauma that she wants to move away from in her life. What the recovery protocol wants to do is to have from this centralized position of the lost or depression or anxiety condition and migrate it over to a position of strength, which is what you see in the diagram on the right side. In the diagram on the right side, you'll notice that she now is in the center of her life as she was prior to the incident and the assault that she had, and that the depression or loss that she has now has a new orbit. It's no longer in the centralized position, but it's orbiting her life just like other issues and other problems that she faces. It's not has a grip that pulls it to be the center of living in her life. We call that a person-centered stance. And that is a recovery position. And in that, a lot of people find it's freeing. They're able to make decisions in their life, taking into account what is important for them, with a minor on how they're dealing with the illness. This is no different than having asthma. At first, it's overwhelming. It's the center of one life. Everything revolves around the asthma, decision-making about who you see, what you do, where you go. And in a recovery position, asthma is once there's a handle on it, that the person now can be returned to the center of their life, and asthma now takes a different orbit. It's in the orbit of other issues in their life or friends or things. They travel in the same orbit. And that is a person-centered position, and that's where the recovery protocol breakthrough wants to take you. Well, there you have it. That was the introduction to the recovery protocol breakthrough. I'm hoping that the introduction clarified a few things for you and let you know what the program is about and what the program can offer to you. And certainly feel free to read further on this published information on this online site for either educational purposes or for implementing the program yourself. Thank you for dropping by.